Pulsed electromagnetic fields. Welcome to the room in which we expose patients various different ways to pulsed electromagnetic fields. Why does the eye doctor use pulsed electromagnetic fields? Because without magnetic fields, we die. Yuri Gagarin, who the Russian cosmonaut who first human to circle the Earth, almost died because the science community didn't realize that when you get away from the magnetic fields that we've evolved around and are exposed to every day, our body doesn't work, our blood doesn't flow. So right here is what's called a beamer. There's many different ways you can purchase units that deliver pulsed electromagnetic fields, and like everything else, the characteristics of the waves, the intensity, the frequency, the incidence, the waveform, whether it's a sine wave or a square wave or a sawtooth wave, and the duration, all these things matter. So do be careful about going and doing it DIY on PEMF for your body or specific organs. So this beamer, this is a cover we have here. This is currently going, okay? And so this mat has a number of rings on it. And if you can hear that. And for the patient who's wondering if it really works, this is a sensor that lets you know that it works. But and then we have this what's called the spot. And I'll link into this video a patient who had a concussion. He fell down and struck over his right eye, and he had speech difficulties. His eyes would not elevate, very sensitive to light. And by the use of this pulsed electromagnetic field unit in this spot, there's some remarkable video showing the immediate washing away of his symptoms, and then they returned as soon as we removed the magnetic field. But the use of this improved his eyes. He can now look up. He wasn't sensitive to light, and he captured his full speech capabilities back. That'll be linked in here somewhere. Corden has trouble with photophobia and elevation of his eyes. This is pre-treatment on May 22nd, and you can see the photophobia here. Now if you try to elevate your eyes, here you go, follow my finger. And I am 40 centimeters away and probably just get up to his eyebrows, and he can't do any more than that. Turn this biostimulator, the beamer spot on, and he's putting it over his left occipital protuberance, and there's no photophobia. Now look at my camera and take the spot away, and it's back, and put it back. Wow. All right, now if you put it over your left temple, photophobia, better or worse?
Worse.
Worse. Sensation?
It's uncomfortable. Longer I leave it there, it starts to head towards painful.
All right, then put it back in the back of your head. How does a light feel on your temple?
Yeah, it's less powerful than the spot, but it's a similar feeling of discomfort.
Okay, and you spoke Friday about when you have it on the back of your head, this feeling, if you go ahead and move it to the back of your head, your optic nerves, you speak of the warm water feeling over the back of your eyes.
Yeah, the best way I can describe it, it's almost like a water hose filling up, and when it gets to the point, if you leave it there, it's almost too much pressure. Mm-hmm. That's when I can open my eyes and the light doesn't bother me as much.
Now, if you go to the right side of the back of your head, if you can reach around there, no, your photophobia is back.
I don't feel anything on that side.
And the back of your eyes don't feel better. And go back. And you'd say that the light is less strong than the spot.
That's correct.
And the setting is at a 3 for 8 minutes.
And now, if you watch my finger, and what I did was I'm 40 centimeters away. I get up to, I don't get as high with the spot, the light, with this superversion. But that third go around a little bit higher. But still, the feeling isn't as successful, and the elevation isn't as high.
That's correct. It's similar feeling. It's just not as strong.
And you have this feeling in your back of your eyes of the warm water feeling.
When my eyes are open, I don't feel it at all. The only notable difference is that I can look. When my eyes are closed, it feels like it's a pressure sort of follows down the back of my eyes and just continues to build.
So when you have your eyes open,
I don't feel it at all in the back of my eyes.
You don't feel the retroorbital warm water feeling. As soon as you close your eyes,
it takes a couple of seconds, then you feel it sort of building back up.
You feel this comfortable pressure until the point of uncomfortable?
It's exactly right. It's comfortable, and then it just continues to build the longer I leave it there, and then I either need to move it or I can open my eyes.
And back to your temple again, what do you have going on?
It's sort of almost like there's a bruise there, and it's poking it. It's a similar feeling. And so the longer I leave it there, the more uncomfortable it gets.
To the point where if you thought you left it there too long, something bad's going to happen?
Probably. It gets to the point, particularly with the spot, the light sensations aren't as strong, but it gets to a point where it becomes very painful.
And then please don't cause that. Feel free to move it whenever you get to that point. So what we're doing here is we're as you can see, the speech is just flat out better when he has a spot and a light in the back of him. And that's a good thing. Whatever we're tickling to cause this is a good thing, and everyone's appreciative of that. What we are hoping is that this will somehow knead the KENAD, knead the problem away, and we're just pursuing here.
We use light. This is photobiomodulation. You'll see me say PBM. And the photobiomodulation is the use of light, whether it's in the blues, the reds, and the near-infrareds, to expose it to the body. And so whether it's to the eye or the brain or different parts of the body, there's a ton of beneficial events that happen when you use PBM. We'll talk more about that in another video. In my hand, as I'm standing here, is my very first pulsed electromagnetic field unit, which is ICES, and these little rings can be put and secured along your temples, and because it's going to be passing these magnetic fields to the eyes and improve the patient with macular degeneration and other circulatory problems. So photobiomodulation, be it the beamer, they also have a light unit there, and in other devices of all different prices and weight, qualities and intensities. I invite you to go look into beamer.com, that's BEMER.com, and put in circulation in videos, and you'll see some amazing videos that show poorly circulating blood turn into rapid circulating blood in just moments. So that's PEMF and a little bit of PBM, and I look forward to you watching more of these videos and learning a little bit more.
We're now 1 month out to the date, and Corin doesn't need sunglasses anymore, and he's had a significant improvement in the past week, and his sensitivity to light in the room that he hates. He used to be squinting in this room with these overhead fluorescent lights, and I'm going to have him watch my pen, and here we go. And he's up as 2 feet above his head now, looking up, and there's no problem there. He's not wincing, no feigning movements. And so that's great. Everything's, we're just talking about it. We think he's somewhere in the 90 percentile of good to go. And what other thoughts do we have, Gordon? Just
feeling better. Things seem to be firing back. Energy levels coming back.
Yeah.
Speech has been resolved for about 10 days now, something like that.
It's fantastic.